many people have been discussing removing ovaries, and I'd like your opinion about that. I hope you don't mind.
So the only thing we'll ask is, Edith, you're not going to discuss Betsy's relative's care. Let's talk about the utility of removing the ovaries in people who've been diagnosed with breast cancer.
Whatever you say, Claire. Yeah, the issue of double mastectomies is a very personal one for each individual. It can be done essentially in three situations. Number one, a person who is found to have a genetic mutation that predicts for a very increased risk of developing breast cancer. So that person, although healthy, may make the decision to proceed with bilateral mastectomy, as that type of surgical procedure has been demonstrated to decrease the risk of developing breast cancer by more than 80%. Okay? So that's one possibility. Second possibility is a person who is diagnosed with a unilateral breast cancer. And that person, although may be appropriately treated by a lumpectomy, radiation, or unilateral mastectomy, may make a decision, I am so concerned about what happened with one breast that I prefer to have a prophylactic removal of the second breast, so ultimately undergo bilateral mastectomy. So that can be a patient preference. And the third situation is a patient who presents with bilateral breast cancers, which sometimes can occur. And although in some cases these two types of cancers can be treated with lumpectomy, some patients also prefer to have bilateral mastectomies. So it's a very individualized decision, one-on-one discussion with physicians, and again, there are those three situations in which this can be considered.
Ovary.
I think the question was ovary as well. And
the
I don't
ovary.
know if,
Yeah, yeah. And then the situation with the ovary, then that connects with all of this, because the removal of the ovaries can occur in two main situations. Number one, the one in which there's a genetic mutation that again predisposes a patient to develop an increased risk of breast cancer, and sometimes ovarian cancer up to 50% depending on the mutation. So a person can make a decision to proceed with removal of the ovaries. Even if the person decides not to have bilateral mastectomy, but just removal of the ovaries can decrease the risk of breast cancer by 50% in premenopausal women. And a second situation in which oophorectomy can be performed in the setting of breast cancer is in young women who develop invasive breast cancer. And modulation of the estrogen levels can be one of the treatments that is pursued, and that can be accomplished with removal of the ovaries.
Right, so for those of you who are fans of the history of medicine, maybe the first reported truly effective systemic, that means body-wide treatment for any cancer, was published in 1896 in The Lancet by a Scottish surgeon named Beatson, and he showed that when he took ovaries out in young women who were still menstruating, their locally advanced breast cancers regressed. They got smaller. And that was actually the beginning, in a way, of modern medical oncology, although it's not often repeated, that story. So there can be a therapeutic reason.